Chemicals are all around us, and we use them on a daily basis even when we're not thinking about it. From the gas you pump into your car to the medicines you take, chemicals are an important part of the world. Some chemicals, like sodium chloride, are relatively harmless and may be ingested. However, chemicals can also be hazardous, meaning they can cause harm to you or the environment. In this video, we will discuss the types of chemicals you may encounter in a lab and how to react in the event of an exposure to a hazardous chemical. Chemicals may be health hazards with acute or chronic effects, or they may present physical hazards by being flammable or explosive. Acute health hazards of chemicals include headache, burns, or loss of consciousness. Chronic effects include cancer and respiratory disease. Physical hazards are associated with a chemical's flammability and reactivity, which can result in fires or explosions. There are some general guidelines you should follow when working with all chemicals. First of all, it is your responsibility to read chemical safety data sheets, or SDS, as well as chemical labels to familiarize yourself with the risks associated with the substances you are using. You should always wear personal protective equipment appropriate for the chemicals you work with. In general, never eat, drink, apply makeup, or store food and drinks in areas containing hazardous chemicals. If you have a drink, even a sealed water bottle, you should store it outside of the lab. As an employee or laboratory researcher at UT, you must take several training courses. General Hazard Communication, or OH-101, which is available online and covered in this video, as well as Hazardous Waste Management, OH-202. OH-102, site-specific training, is also required. This course is taught by your supervisor and is specific to your lab. If you work in multiple lab spaces, you must complete OH-102 for each area. You are also required to take Portable Fire Extinguisher Training, or FF-205. It is very important that all chemicals be properly labeled for identification of content and hazards. All chemical containers have labels that include chemical name, manufacturer, and health or physical hazards. Additionally, the body organs affected by the compound will usually be listed as well. For example, a particular chemical that is an inhalation hazard may state that the chemical targets the lungs on its label. If a chemical is transferred to another container for use or storage, be sure to label this new container. Include the chemical name or list of ingredients, your initials, and the date. Be sure the new label is easy to read and interpret, so avoid structures and formulas. If you need to draw a structure, for example, if it is a compound that you have synthesized, it is wise to include a lab notebook page reference for the compound. Chemicals are grouped into categories based on how they react as well as their hazards. Compounds with physical hazards include flammables, combustibles, oxidizers, reactives, and compressed gases. Compounds with health hazards are corrosives and toxins. First, let's discuss flammables and combustibles. These are substances that can easily catch fire and burn. Examples of flammable chemicals are acetone, gasoline, hydrogen, propane, metal powders, matches, spray paint, and organometallic reagents. Examples of combustible chemicals are motor oil, mineral oil, paper, and sawdust. The physical hazards of these chemicals are fire and explosion. Flammable compounds are often volatile, which means they evaporate readily and should be used in a hood. Accordingly, health hazards from these compounds may include acute effects such as headache, dizziness, nausea, dry and irritated skin, watery and stinging eyes, and inflammation of the eyelids. Since fire and explosion are physical hazards of these compounds, additional health hazards are burns and cuts. The chronic effects of flammables and combustibles include general damage to the lungs, liver, and kidneys, as well as possible cancer risk. The container of a flammable compound should be closed when not in use and never placed near an open flame or ignition source. If a lab contains 10 or more gallons of flammables, it is university policy that the chemicals must be placed in a flammable storage cabinet. This cabinet protects the contents from heat and sparks outside of the cabinet. Oxidizers are substances that can react with other compounds in a process called oxidation. In some cases, they can increase the burning of fuels. Examples of oxidizers are organic peroxides, such as benzoyl peroxide, concentrated nitric acid, sodium hypochlorite, also known as bleach, oxygen, concentrated or heated perchloric acid, concentrated sulfuric acid, and concentrated hydrogen peroxide. The physical hazards of oxidizers are fire and explosion. Again, cuts and burns are a health hazard associated with oxidizers. Acute effects of oxidizers include inflammation and destruction of tissue, severe irritation of the upper respiratory tract, and irritation of nose and eyes. Some chronic effects from exposure to oxidizers include damage to the nervous system, fertility disorders, and carcinogenesis from certain chromium compounds. Reactives are substances that catch fire or explode when subjected to certain conditions. Reactives can present fire hazards. Pyrophorics react when exposed to air, and water reactives can form ignitable gases by reaction with water. Reactives present explosion hazards because shock-sensitive compounds can explode if shaken or dropped. Concentrated peroxide formers can form explosive compounds when exposed to air, and explosives can detonate if subjected to sudden shock, pressure, or high temperature. Due to the possibility of fire and explosion with these compounds, the main health hazards include burns and cuts from breaking glass. These compounds may have other toxicity as well, and it is wise to thoroughly review the safety data sheets. Reactives should be separated from other chemicals and stored in a protected place away from high traffic areas. Compressed gases are pure gases or mixtures of gases in a container that is under pressure. In general, compressed gases are stored in metal cylinders. Examples include nitrogen, helium, and chlorine. If tank regulators are damaged, the cylinder can propel like a rocket, causing great damage. Inhalation of gases causes hazardous health effects due to oxygen displacement and asphyxiation. Chlorine gas is also a toxin and is very poisonous. If you will be working with compressed gases, you should take the compressed gas training module provided by EHS for more detailed information. Corrosive compounds are generally acidic or basic. Caustic basic compounds and corrosive acidic compounds can destroy human tissue. Examples of corrosive compounds are sulfuric acid and hydrochloric acid, which are, of course, both acidic corrosives. Sodium hydroxide, a main component in Drano, as well as ammonium hydroxide, are examples of basic corrosives. Corrosive basic compounds can etch glass, and corrosive acidic compounds can destroy metal. Accordingly, proper container selection for acidic and basic solutions is imperative. Acute health effects can result from the destruction of tissue caused by corrosives. These effects include irritation of mucous membranes, difficulty breathing, respiratory irritation, headache, intense pain in the eyes, possible loss of vision, and nausea. Chronic health hazards of corrosives include the destruction of the respiratory tract and severe damage to the digestive system if ingested. Corrosives should be stored in appropriate containers. Often plastic is a good choice. Acids and bases should never be stored together. Acids should be stored inside an acid cabinet or in a plastic secondary container inside a wooden cabinet. The containers should be stored close to the ground and never above eye level. Do not store inorganic and organic acids together, and always store nitric acid by itself. Bases should also be stored on a shelf close to the ground. It is wise to store corrosives near the eye wash or safety shower. Toxins are poisonous substances that cause serious health risks, even in small amounts. Toxins in general are poisons, and they may also be flammable or reactive, which can lead to them also being a fire or explosion hazard. Be sure to check the SDS to be aware of all hazards of the compounds you're working with. Exposure to some toxins can cause acute effects, such as dizziness and headache, and some exposures can even be deadly. Some toxins have chronic effects. For example, the organic solvent benzene can cause cancer. Some chemicals can cause harm to the reproductive system. These compounds are called teratogens. Finally, some toxins cause damage to specific organs. For example, silica gel and asbestos target the lungs. Store toxins away from other chemicals and use secondary containers when transporting them, even short distances. When storing toxins, don't just group them together. Be sure to continue to separate incompatible materials. For example, a toxic oxidizer should never be stored with a toxic flammable or combustible material. Separate nitric, perchloric, and concentrated sulfuric acid from organic acids, which are often flammable. Always remember to separate acids from flammables and bases. A chemical exposure occurs when a chemical gets on or into your body. Wearing personal protective equipment can reduce your risk of an exposure. There are several major routes of chemical exposure. Inhalation, which occurs when a chemical is breathed in. Skin and eye contact, ingestion, and puncture wounds. You should report all chemical exposures to EHS, even if they seem minor at the time. Inhalation is the most common way of being exposed to a chemical. Chemicals can get into the air in the forms of gas, vapor, mist, or dust. And if you breathe chemicals, they enter your body through your lungs. Given the large surface area of the alveoli in the lungs and the large blood flow to this area, even a relatively minor inhalation exposure has the potential for great damage. For an inhalation exposure, immediately move the exposed individual to fresh air. Bring them outside of the lab and outside of the building if necessary. Seek medical attention if the chemical is hazardous. Do not enter the area if the chemical is still in the air. If you are very concerned, contact EHS to check the area. Skin and eye contact is the second most common way to be exposed to a chemical in the laboratory. The first step after spilling chemicals onto the skin is to flush the affected body part with water for 15 minutes. Clothing and jewelry should be removed at and below the area of the spilled chemical. If a chemical gets into your eyes, flush the eyes for 15 minutes in the eye wash. Hold eyes open and flush behind the eyeballs and inside the eyelids. Eye washes must be activated at least once every week to keep the plumbing flushed with clean water. Turn it on and run for 2 to 3 minutes. These dates should be recorded on the tag at least monthly. Safety showers are tested annually by Facilities Services. Contact them if you feel a shower needs to be tested. You do not necessarily have to spill the chemical directly on your skin to be exposed to it. A contaminated object can serve as a vehicle for exposure. A contaminated cell phone can cause a chemical exposure. Accordingly, you should never text with gloves on or use your cell phone or iPad in general while wearing gloves. Due to the risk of exposure, it is also advisable to not wear gloves when using computers. If your gloves are contaminated and the next person uses the computer without gloves, you could accidentally expose your lab mate to chemicals. Basic procedure after contact exposure. Thoroughly rinse the exposed area for at least 15 minutes. Never neutralize the chemical on the skin. The resulting reaction can be more detrimental. Seek medical attention as necessary. And always ask for assistance verbally from your lab mates. Never make physical contact if you've been exposed to a chemical. Finally, call EHS to report the exposure. Ingestion exposure usually occurs when someone eats after his or her hands become contaminated. Thus, glove use and good hand washing can minimize the risk of this type of exposure. If a person is exposed to a chemical by ingestion, call poison control at 1-800-222-1222 or dial 911. Do not eat or drink anything unless directed by medical personnel. Puncture wounds occur when the skin is broken by a sharp object, such as a nail, glass, or needle. Puncture wounds that result in chemical exposure can be very harmful, and those that occur with a clean object can still cause infection. Contact medical help as needed. We can prevent chemical exposures in several ways. Inhalation exposure can be prevented by using hazardous chemicals in a fume hood. The fume hood is a source of ventilation. Puncture wounds can be prevented by using a sharps container to dispose immediately of needles, syringes with a needle attached, razor blades, and broken glass with infectious materials. Another key to avoiding puncture wounds is to never recap needles, bend them, or remove them from syringes. Stored chemicals can be equally as dangerous as chemicals you are actively using in the lab. Proper chemical storage can prevent exposure. Some storage guidelines are: store chemicals together only if they are compatible. For example, don't store acids and bases, acids and flammables, or oxidizers and flammables together. Don't overstock chemicals. Store hazardous chemicals on shelves lower than eye level. Remember, the farther the fall, the bigger the splash. Never store containers on the floor, as they are easily knocked over and broken. With proper handling, storage, and exposure preparedness, we can minimize the dangers of working with hazardous chemicals. Know the types of chemicals you are working with, the health hazards associated with them, and how to respond in an emergency involving a hazardous chemical. Working with chemicals is part of most biology and chemistry laboratories, and working with chemicals can be fun and rewarding. Chemicals should not be feared, but should always be respected. Preparing yourself to work with chemicals by reviewing SDS sheets, knowing what to do in the event of an exposure, and remaining calm in the event of an emergency will help you work safely with chemicals.